Breastfeeding cafes are popping up across the country, with a couple of them being in Florida. This comes as part of a statewide renewed push to advocate for stronger support and resources for breastfeeding mothers and their babies. Here to talk about breastfeeding and also alternatives to breastfeeding is Dr. Phillip Caravella. Good morning.
Hey, good morning. Thank you, Markia, for having me here.
No problem. So, as I mentioned, we were talking about breastfeeding cafes.
Right.
What are they?
Well, they're little places that people can go to for information on how to learn how to breastfeed their child. And they can do this, they should do this probably later in pregnancy, but obviously before they deliver. Also, they can go there when they start the process of breastfeeding and so forth and so on. So they're starting to spring up all over, and they have experts there who will help work with mothers and instruct them on how the correct methods should be to breastfeed their child.
Okay, and you were telling me there is a connection between breastfeeding and weight loss. Can you explain that a little bit to us?
Well, breastfeeding has a lot of remarkable benefits for the mother and the baby, but with the mother, for openers, it does allow them to lose some of the weight that they gained during pregnancy. Other advantages, it lowers their risk of breast cancer, ovarian cancer, and uterine cancer. And it helps them to bond with the baby, which is really a huge benefit. And then for the baby has many benefits too. The baby will have a lower incidence of developing type 1 or type 2 diabetes, fewer allergy problems, less problems with asthma and other intestinal problems. The baby just matures intellectually more rapidly, has even been known to have a higher IQ. So there's a lot of benefits. And again, the bonding technique with the mother and so forth is critical.
So if a mother is not able to breastfeed, what would you suggest she does?
Well, I mean, almost all mothers can breastfeed. There's only less than 5% are not able to. Having said that, 75% will start to breastfeed, and only 40% will reach their goal. But I think with these breastfeeding cafes and with education, almost everyone will be able to breastfeed. Now, there are women who cannot, because they maybe have had breast surgery or other medical illnesses. And those people then would have to use formulas and that type of thing.
All right, you quickly tell us about your book.
Well, my book is a book written in reference to how to lose weight and maintain weight once you've lost it. And it goes over all of the principles of exercise, fitness, and nutrition in a way that's never been done before. It has prescriptions for people based on their BMI, and it varies depending on their health issues too. The thing is, if people learn what's in the book, they will be successful in losing weight and keeping it off for the rest of their life.
All right, thank you for joining us this morning. Now here's Mike Potter with another look at your